I'm Dr. Alexandra Smith. I'm a naturopathic doctor here at Nirvana Naturopathic Medicine, and I primarily focus on women's health and hormones. IBS is defined as irritable bowel syndrome, and essentially it's a diagnosis of exclusion, where a patient has been worked up for everything else that might be causing these symptoms. We can't really find what it is, and so it's just labeled as an irritable bowel. And often it's characterized as having either diarrhea or constipation, experiencing some form of digestive upset or difficulty with digestion every time you eat or often when you eat. And again, usually like a lot of testing has been performed and there's nothing that shows up on findings. And so then a patient is labeled as having IBS. I always take a really thorough health history to understand what are the digestive symptoms. Is there any other area that may be being affected by somebody's gut health, like skin, for example, or hormones? And then with that, I'll understand if these symptoms are impacting, especially with like bloating and diarrhea and constipation and those sort of symptoms, if it's being affected after every time that they eat, usually 60% of the time, 70% of the time in some of the research that's been shown, it's some form of gut microbiome imbalance. So that's where there's some kind of bacterial overgrowth. Maybe it's a yeast overgrowth. Virus parasite can sometimes show up, but bacteria and yeast are far more common with things like this. And looking at comprehensive gut microbiome testing can help us piece that together so that we can build the gut microbiome and see what's growing in there so that we can treat it effectively. I'll primarily look at stool analysis for something like this, where we collect the stool, and I usually will look at a 3-day stool analysis so that we're getting a variety of samples. And we look at PCR testing, which looks at small DNA fragments of all of the bacteria, yeast, viruses, parasites that might be in the gut. And then we also look at culture. And so that's where they take a small piece of the stool sample and allow it to grow on a petri dish and what grows, so that we can compare and understand, okay, what is the makeup of the beneficial bacteria? So all the good guys that are often labeled as probiotics and supplements, beneficial bacteria. And then what's growing in there that shouldn't, or what's overgrowing in the gut. And then we can piece together how to treat it effectively. But stool analysis is kind of the main starting point for testing like that that we'll look at. Variety of antimicrobial herbs that are either targeted towards a bacterial overgrowth, a yeast overgrowth, maybe a parasite if that does show up. But it's targeted treatment depending on what comes up on the testing. There's one piece of it that like symptoms are really helpful for us to understand what is the most indicated testing to look at, but then the testing allows us to really target and zero in on what we should be using for a protocol, right, for antimicrobial therapies. If there's a yeast or a bacterial overgrowth, patients can usually expect to be on some form of antimicrobial therapy for about 4 to 6 weeks, sometimes up to 8 weeks in more persistent symptom pictures. And then generally patients are on a probiotic at the same time, so that as we're killing the things that we need to get out of the gut, we're repopulating with the beneficial bacteria, so the good guys that we want to stay in the gut and colonize. And then after that antimicrobial therapy, which is about that 4 to sometimes 8-week treatment protocol, we then move on to what's called the gut healing, where we work to help heal the lining of the entire gastrointestinal tract and the small cells that sit within that gastrointestinal tract.
It's really common that the small cells, they're called enterocytes, and they essentially are supposed to sit in the gastrointestinal tract super tightly together and super close. And what can happen when there's bacterial overgrowths is that essentially those tight junctions, or what they're called, between each cell become loose and become leaky. And that's where this idea of leaky gut comes from, where large food particles and toxins can pass through the gastrointestinal tract between these junctions instead of having to go directly through the cell. And so what the gut healing part of the treatment protocol looks like is adding in herbs and nutrients that line that gastrointestinal tract and allow those cells to heal, so that then our gut does go back to absorbing food through the cell and not around it anymore. And generally in that piece of the protocol is where a lot of dietary changes come in, where we try to increase the diversity in the diet in terms of different fibers that we're eating. So whether that's coming from a lot of vegetables and fruits, but also whole grains, are super important to help build the robust nature of the gut microbiome, because the more different foods that you're eating in the diet, the more different beneficial bacteria you're going to have in the diet. So we really try to zero in on that. And that kind of protocol lasts anywhere from about 4 to 6 weeks usually. And then we kind of let diet lifestyle take over, where we still focus on diversity in the diet and still focus on how can we keep these beneficial bacteria really healthy and happy, so that we don't get back into a situation where we're experiencing the symptoms associated with IBS. So stress is a huge one, right? The more stress that we're under, the less digestive capacity we tend to have, because if we're sitting more in that fight or flight system, we're not sending as much blood flow to digestion areas, right, or to our gut. And so stress is going to have a huge factor on the makeup of our gut microbiome. And there's also a nervous system that communicates with our gut microbiome from the brain, and inherently we have a communication system from the gut that communicates with the brain as well. And so it's a two-way communication system. And if we're under significant stress, then that's going to affect the gut microbiome and can sometimes be a trigger for a lot of these symptoms. The foods we put into our bodies are absolutely a factor, right? If we're eating more processed foods, we're going to be more likely to develop symptoms associated with IBS, because we're not getting the fibers and the nutrients necessary to feed that appropriate gut microbiome. So then we decrease diversity in the gut, we lose a lot of those beneficial bacteria, and then we create an environment that's perfect for something to overgrow. And yeast would be really common here, bacteria can be common here too, where something gets into the gut and it's like, hey, I've got a lot of space here, I'm just going to grow out of control. So that can be a factor too. Alcohol can be a factor as well for the gut. If we're drinking heavily, that is going to affect our gut microbiome, so that can be a factor. Your sleep, if we're not sleeping well, can be a factor with causing some of these symptoms and triggering a lot of them. What's interesting about things, especially in relation to the gut microbiome, is that oftentimes there's not a particular food, like one food that triggers it. Like every time I eat broccoli, I get gas and bloating and have diarrhea. It's more so that those symptoms seem to wax and wane depending on what the microbes decide to feed on. And so one day you feel totally fine eating broccoli, the next day it's awful. And that is a really telltale sign that there's some kind of gut microbiome imbalance, and that it's not a true food sensitivity or food allergy. Acne is probably the biggest thing I see with gut microbiome imbalances, just because it is so common. But really, really common when we think about that like leaky gut-blood barrier, where the small cells that are supposed to be sitting super tightly together are no longer doing so. Through it's creating an inflammatory process in the body, and that can show up as a skin concern, right? Our skin is a huge detoxification organ, and so when our gut isn't doing detox as well as it could by having regular well-formed bowel movements, we can start to see that our bodies detox in other places. And so acne, rosacea, psoriasis, eczema, those can all be concerns related back to the inflammation in the gut. Also, the gut microbiome is the biggest microbiome we have in our bodies, and so it can govern other microbiomes. We have a microbiome on our skin, we have a microbiome in our vaginal canal, in our urinary tract. And so if our gut microbiome isn't optimal, it has a trickle-down effect to those other areas of microflora. And so then that could be a factor too with skin concerns. The big one with hormones is that all of our hormones are detoxified in our liver, which our liver sits just below our rib cage on the right side, and it does the primary detoxification. So as our hormones fluctuate, especially for women, they fluctuate a lot through the menstrual cycle. Men don't have the same kind of fluctuation of hormones, but as those hormones fluctuate, we have to be able to detoxify them and get rid of them, and primarily we poop them out eventually. So they get dumped into the gastrointestinal tract and we poop them out. And if that isn't happening properly because there's gut microbiome imbalances, we're more likely to develop hormonal imbalances further up the chain, essentially, because that's the third phase of our detoxification system, right? First two are in the liver, and then we rely on the gut to do that third and final step to get rid of our hormones appropriately. What's nice about looking at testing is that generally when we look at the gut microbiome, we can look at an enzyme called beta-glucuronidase. And beta-glucuronidase is a really key enzyme to understand why hormonal imbalances might be happening because of gut health. Beta-glucuronidase primarily is produced by non-beneficial bacteria, so things that are growing that shouldn't be in the gastrointestinal tract. And essentially what it allows for is reabsorption of estrogen detoxification products. And so then it can further promote high amounts of estrogen in the body. So it's key for us to understand gut health when we're thinking about hormonal imbalances too. If they haven't done testing yet, to look at comprehensive testing, because a lot of people, they are doing all the right things. They're eating the right foods, they're moving their bodies, and from that perspective, we should feel good when we're doing all the right things. And so having a full health assessment and understanding, okay, what does the quote unquote doing the right things look like? Because for everybody that's a little bit different, and there's a lot of information out there in terms of what is good versus bad. Next step is looking at testing, because when we can figure out what is causing the symptoms, then we can help. First step is calling the clinic to book a discovery call and see kind of who the best practitioner fit is for a patient. And if they are experiencing those symptoms, then understanding that we can look at things in a really comprehensive manner to piece things together for them and give them the answers, but also have clear and indicated treatment protocols for this, right? So that we can minimize these symptoms and get back to appropriate gut health and a well and robustly defined gut microbiome.